Living Lab Denmark is an international user-driven and cross-organizational ecosystem within healthcare and social care.
Well, good ideas are ideas that actually solve a real problem. So the first key thing is to figure out what are the problems in the healthcare sector that we want to solve. And figuring these challenges out, we use anthropologists to do the research, following our users in the hospital's daily work. And then we analyze the data on these observations and try to figure out which problems are the usual ones that have the greatest potential for innovation. Today our guests are going to experience what happens when you focus on people in your design process. The most important thing is that you get a clear understanding that when you design the future hospitals, that you are designing it for people. And people are changing, evolving, and we don't know who the future patients are, but we are guessing, and whatever guess we work on, we're going to create a design fitting those needs. And I believe that when we invite the guests here, that they will experience that these key issues about regular people habits and so on are so important for the solution that you pick.
I think there will be two major things they can see. One is the set of specific technologies that we demonstrate here. People can touch them, they can play with them, they can see what we really work with very specifically. The other thing is that they can see a linked set of players that work together on this. We have the hospitals, nursing homes, municipalities, Danish Technological Institute, a lot of companies, researchers. You have the whole link or the whole chain of organizations working together on this. In the old days we talked about ideas, development, testing and so on. Today it's more an integrated, cyclic, iterative approach that we use. The ideal process for us is to involve the end user at the idea stage. So working from the idea, then through a number of design steps, where you design the whole system, you design the components, the interfaces, the interaction that the user is going to have with the system. To use the user, that loop is very critical, and then use all that feedback to iterate on the design and optimize on that is very unique.
I think what they can bring home is they can see that it's actually possible to change the way that you deliver care by the use of technology. But also they can give some experiences from ours about how to do it if you want to go from a bright idea over a tough implementation or testing and implementation process into daily use. I think that what we have succeeded in is to create that environment where you can collaborate between public and private companies, and we have a lot of really good, really skilled clinicians that is open-minded and ready to go into the process and deliver their part of the knowledge into the process. And on the other hand, companies can benefit from that and they have to deliver their part of it. So we have been really good in creating that environment. We have also been relatively good in actually getting the ideas into products, turning them into projects that has been tested and delivered the clinical evidence for it, and then finally go into daily production. So we have been relatively successful, I would say, in going from the idea into implementation.
When I first started to get involved in e-health in Europe, Denmark was the place that people said you should go and talk to, because Denmark, perhaps in a technologically unsophisticated way in those days, but had embraced sharing health records, working differently, using computer technology long before other parts of Europe, and showcasing some of the terrific work that's going on here in and around Odense and Funen is vital. The challenge in front of especially senior people in medicine and in managing healthcare is huge. You know, the new hospital here in Odense is going to need 20–30% less beds than the one that we've got now. that isn't just a small change, it means a massive change in the way people are cared for. One is to make sure that the use of technology in healthcare doesn't stay in a cupboard somewhere looked after by geeks, that it's actually a top office, the boardroom subject with the chief executive, the chief medical officer owning this problem and understanding how technology can support the way people work and the way they're cared for, whether it's in the hospital or at home or while they're on the move or at work. So it's an executive responsibility, not a technological responsibility. And the second thing is to make sure that you have a platform for spreading innovation. You have terrific broadband connectivity here into people's homes with fibre to the home, etc. So that's a terrific advantage, and you need to keep that fabric of communications and collaboration infrastructure up to speed, because then people will invent things and they will spread those innovations very quickly. Healthcare's got to go through huge change. We can't carry on looking after people the way we have for the last 30 or 40 years.